Okay, students, we're going to talk today about skull anatomy. We're going to do the anatomy of the skull first. So then we'll go into the positioning of the skull. We'll go into facial bones after that. So when we do positioning of the skull, it's very different than doing anything else where, we do AP and lateral and it's set 45, 90, whatever angles we're going to be doing if it's obliques or lateral or AP or PA. We use all of that and we're going to build upon that also. But in order to do that, you really need to understand the anatomy going into it so you understand how it lies within the skull and how to get the images of what you need. So when you are positioning for a skull, you need to make sure that you talk to the patient and have really good communication with the patient on what you're going to be doing, because if you tell the patient to hold still and they don't hear you, they're going to turn their head and you're going to lose all your positioning. So you also want to set up all your technical factors ahead of time to make sure that you are ready to shoot so that the patient doesn't move. All right, so the typical skull is called mesocephalic, and the petrous ridges project anteriorly and medially at a 47-degree angle from the mid-sagittal plane. So I'm going to start referring to MSP and all the different lingo as we move through the skull. So from here on out, mid-sagittal plane is MSP. The brachiocephalic skull, so the petrous ridges project anteriorly and medially at a 54-degree angle from MSP. So it's short from front to back, and it's broad from side to side and has a shallow from vertex to base. The dolichocephalic skull, so the petrous ridges project anteriorly and medially at a 40-degree angle from MSP. So it's long from back to front and narrow on the sides and deep from vertex to the base. So asymmetry of the outer features should be noted while positioning. So for example, the nose, you can't use the nose as positioning. You need to look at your parietal eminence to see. A lot of people have crooked noses. So the mesocephalic skull, so this is the average skull type, and the width is 75 to 80% of the length. So this is a typical skull. If we look at the different ones, if we go the dolichocephalic here, you can see it's long and skinny, and we have a 40-degree from mid-sagittal plane, and we go into the mesocephalic, which is typical. Here, this is 75% of the length, and here it's 75 to 80, and we're at a 47-degree angle with the petrous ridges. And we look here on the brachiocephalic, brachio, think more, we have a 54-degree angle, so it's wider than it is long. Okay, so the cranium has 8 bones, facial bone has 14. We'll cover the facial bones after we do the skull. So looking here, we have ethmoid, frontal, parietal, occipital, temporal, sphenoid. So looking at an AP projection, you can see the sphenoid is red. We have ethmoid is blue, and we have the temporal is purple, parietal is green, and your frontal. So your calvera of your skull has the frontal bones, occipital bone, the right parietal and the left parietal, whereas the floor has your ethmoid, sphenoid, right temporal and left temporal. Looking here, we have on the frontal bone, we have the gabella, the bregma is up top. So we have the frontal bone, parietal bone, occipital bone, temporal bone, sphenoid. So gabella, bregma, coronal suture, pterion, squamosal suture, here's your mastoid process, asteron, and this is your lambda with your lambdoidal suture in between, and we're going to go deeper into this. So your cranial floor is divided into 3 regions. This is the anterior, middle, and posterior. In the anterior houses the frontal lobes of the cerebrum, extends from anterior frontal bone to the lesser wings of the sphenoid. The middle houses the temporal bones, extends from the lesser wing of the sphenoid to the apices of the petrous ridges, and the posterior is for your cerebellum, pons, and medulla oblongata. So when we're looking here, we're going to cover here again. So the frontal, parietal, occipital, temporal, sphenoid, and then you have your ethmoid in there. Looking here, just at the floor, we have your frontal, your ethmoid here, which is blue, We have your sphenoid here in the red. Green is your parietal. Temporal is your pink, and occipital is your blue. So going a little bit deeper here, here's your anterior, middle, and posterior. So you can see here we have your crystal galli on your cribriform plate of your ethmoid bone. You have your orbital plate of your frontal bone. Here's the bone that comes, think of your eyeballs, the orbit. So this is the orbital plate of the frontal bone. You have your sphenoid here in blue. So we have the lesser wing here, and we're going into some detail, so hang in there. We're going to cover the sphenoid bone and you'll understand all of this. But you have your optic canal or foramen, and then you've got your anterior clinoid processes, this little wings here. So this whole portion is your lesser wing. This whole portion is your greater wing on either side. Within the greater wing we have the foramen ovale and the foramen spinosum. You have your foramen lucerum right here, lacerum, sorry, and then you have your dorsum sella with your posterior clinoid processes. So you see these little hooks right here, that's your anterior clinoid process, and the little hooks back here are your posterior clinoid processes. You have your jugular foramen here, this is your temporal bone, and this is your occipital bone, and you have your foramen magnum with your hypoglossal canal. Your clivus is the portion right in here, which is coming up from your basilar portion of your occipital bone going into the clivus, which is right in this area here. You have your petrous portion, dipole here, spongy bone, temporal bone, foramen spinosum, ovale. You have your optic groove with your greater wing, lesser wing. So there's one frontal bone, there's one ethmoid bone, one sphenoid bone. There's a right and a left temporal bone and a right and a left parietal bone with one occipital bone, so don't get that wrong. The sutures, so we're looking here, the cranial sutures, there's coronal, lambdoidal, squamosal, and sagittal, and then the junctions and points are astron, bregma, lambda, and pterion. So looking here, we have the coronal suture with the bregma up top, and we have the right pterion. You can see the sphenoid bone and the temporal bone with your squamosal suture with your right astron. You have your lambdoidal suture here, and this is your parietal bone. So looking at it tilted, you can see your frontal bone with your bregma and your sagittal suture. Here's your coronal suture, your squamosal suture with your right pterion. So looking posterior PA, so here's your sagittal suture with your lambdoidal suture with your lambda, and you have your right astron and your left astron. With kids, we have fontanels. So we have anterior and posterior fontanels, right and left sphenoid fontanels, and right and left mastoid fontanels. So the anterior fontanel is here, the posterior, so you can see here anterior fontanel, posterior fontanel, you have your occipital bone, your parietal bones, frontal bone. So when we look here, here's your anterior fontanel, your right sphenoid fontanel, because here's your sphenoid bone, here's your temporal bone, and back here is your right mastoid fontanel. So there's right and lefts on those. Here's another picture. Here's your anterior and your posterior fontanels. I don't know why they put it on this one and not on this one, but okay. Here's your sphenoidal fontanel and your mastoid fontanel. So now going into your frontal bone, it has a vertical portion which we call the squama and a horizontal portion. So the frontal squama forms the forehead and the anterior part of the cranial vault. The horizontal portion of the frontal bone plates form the roof of the nasal cavity and the greater part of the cranial fossa. The frontal sinus is contained within the two tables of the squama on each side of the MSP. So there's actually two of them. And usually one side's bigger than the other, that's normal. They articulate with the right and left parietals, sphenoid, ethmoid, nasal bones, and zygoma. So looking here at your frontal bone, you have your frontal tuberosity or eminence. It's the part that sticks out on your frontal bone. You have your supraorbital groove with your supraorbital notch. So there's a little notch cut out. If you call it a notch or a foramen, I don't care which one you do. Here's your supraorbital margin, and you have your superciliary arch. So you have your supraorbital margin with your superciliary arch with your supraorbital groove. All right, and then your gabella there in the middle. It's important that you know your gabella because that's a major landmark for us. So, like I said, landmarks. So you have your frontal eminences, your supraorbital margins, your superciliary arch, your supraorbital foramen, and your gabella. So we use all of those in positioning. So when we're looking here at the lateral, we'll start here with your frontal eminence. Here's your frontal squamous. You have your supraorbital foramen or notch, your superciliary arch with your nasion and your gabella. So your nasion is down below your gabella. So looking here, you have your frontal tuberosity or eminence, supraorbital groove goes down to your gabella. You have your superciliary arch and your SOM, and then here, down below, right here is your nasion. So where it kind of curves right there, so here's your gabella, and then down here is your nasion. So there's two different landmarks that you're going to be required to know. Looking at it AP, you have your eminence here, your superciliary arch, your supraorbital margin is right here, and then you can see your little notch or foramen right there. Here's your gabella, and then your nasion is here. This is your nasal spine. All right, so this is looking bottom up. So we have your gabella, so your nasion will be down here. Here's your nasal spine. You have your orbital plate here, and this is your notch where your ethmoid goes. So it's called the ethmoidal notch. Here's your SOM and your superciliary arch. All right, so let's talk about your ethmoid bone. It consists of a horizontal plate, a vertical plate, and two light spongy masses called labyrinths. It's located between the orbits and forms part of the anterior cranial fossa, nasal cavity, orbital walls, bony nasal septum. So the horizontal portion of the ethmoid bone is called the cribriform plate. The cribriform plate contains numerous foramina that transmit for your olfactory nerves. The crista galli is a projection at anterior middle of your cribriform plate. So it's the part that anchors down the brain. It's just a little teeny fragile bone. The perpendicular plate is a vertical portion that goes down. So the crista galli goes up and the perpendicular plate goes down, and it forms the superior portion of the bony nasal septum. So the crista galli is up with the brain and the perpendicular plate is down in the nose. All right, your labyrinths contained within the ethmoid sinuses or air cells. The walls form part of the medial walls of the orbits and the lateral walls of the nasal cavity. They have two thin scroll-like shaped projections, superior and middle nasal concha, and articulates with the frontal sphenoid, lacrimal, maximo, maxilla, and vomer. So here is a picture of your ethmoid bone. So here is your crista galli, your ethmoid sinuses, your medial orbital wall. So this is where your orbit is. You have air cells. You have your perpendicular plate here with your middle nasal concha, and you have superior nasal concha up top. Looking at the superior aspects, so we have the perpendicular plate, and you have your anterior, middle, and posterior air cells. So your cribriform plate, you can see where the nerves come through. Your crista galli is the part that sticks up and anchors down the brain. So looking at where it articulates, so here's your cribriform plate with your crista galli. So this goes up into the brain. This goes down into the nose, your perpendicular plate here. This articulates with the frontal and the nasal. And this down here is the nasal septum is where it articulates, and the vomer is back here. So the perpendicular plate, and then you'll see the vomer, which is like a cartilage instead of a bone. And the sphenoid attaches here. Here's where it sits inside the skull. So you can see here the sphenoid bone. You have the body of the sphenoid, the pterygoid process here, and the hamulus down below, and the vomer where it's touching the perpendicular plate here. And you have your cribriform plate with your crista galli sticking up right there. That's your frontal sinus. So here's a CT. This is a coronal CT, and we have here your maxillary sinus, and this is your ethmoid bone. This is your crista galli sticking up right there with your cribriform plate. Perpendicular plate, can't see it real well in this one. Here you can see the perpendicular plate well here, and you can see anterior, middle, and posterior air cells. This back here, these big ones, that is your sphenoid sinus. So anterior, middle, posterior, ethmoid air cells, and then you can see these are a lot bigger, and they are your sphenoid sinus. So parietal and occipital bones, what we're going to roll into now. So we're at the frontal. Here's your parietal, tubercle or eminence, so that's the widest portion, and this is your parietal bone, and your occipital bone, temporal bone, sphenoid bone. All right, so parietal bones, somewhat square, have convex external surface and concave inner surface. There's the parietal eminence, which is the bulge near the center of the external surface of each bone. That's the widest portion. If you're going to measure the skull, that's where you're going to measure from. Okay, it articulates with each other at the mid-sagittal plane. So it's the frontal, temporal, occipital, and sphenoid bones that it articulates along with itself. So don't forget that one. So here articulates with the opposite parietal bone. Here's your eminence, the widest portion. Here's your occipital bone where it articulates the temporal bone and the frontal bone. You can see here looking down, here's your frontal bone, and you have your superior sagittal suture there with your left and right parietal bone and your occipital bone back here. So looking at your occipital bone here, we're going bottom up. This is your squamous portion. This is your inion. I'm just going to call it inion. It's your external occipital protuberance, and this is your foramen magnum in your lateral condylar portion. So this is where your atlanto-occipital joint is. So the one thing I wanted you to see on this slide was just the grooves for the meningeal vessels. So these are meningeal grooves so that the vessels have room, okay? So the occipital bone is situated at the posterior inferior part of the cranium, forms the posterior half of the cranial base and the greater portion of the posterior cranial fossa. It has 4 parts, so there's the squamous, 2 occipital condyles, and the basilar portion. The foramen magnum is the largest opening where the medulla oblongata passes through to exit the cranium to form the spinal cord. So the external occipital protuberance, prominent process on the squamous, I call it the inion. It corresponds to the internal occipital protuberance. So there's an outside and inside that protrudes, and so one is called the inion and the other is the internal occipital protuberance. So the occipital condyles project anteriorly from each side of the squama, and they fuse at the basilar portion to complete the foramen magnum, articulate with the 2 parietals and the 2 temporals, the sphenoid and the atlas of C1. So here is your squamous portion, and then you can see your inion here, so you can see it pops out a little bit. Here's your foramen magnum, your occipital condyle, your basilar portion here, and then your condylar canal. So looking at the inside, here's your fossa for your cerebrum, and then you have your internal occipital protuberance, and then down here is for your cerebellum. You have your hypoglossal canal, your foramen magnum, your jugular process, and your condyle for articulation with the atlas are these 2 right here. This is your basilar portion. So looking at a CT coronal, you can see here this is your occipital condyle, this is your atlanto-occipital joint with your lateral mass of C1 and your odontoid and dens there. So looking at a sagittal view, you have your squamous, here's your inion coming down to your foramen magnum, here's your condyles for articulation with your atlas. You have your hypoglossal canal and your basilar portion, which goes into your clivus. Now we're going to talk about your temporal bones, and we're going to have to talk about a little bit of the hearing bones within it. So here we have the frontal bone, parietal bone, occipital bone, your temporal bone, sphenoid bone. Now when we're looking at your temporal bone, we have the squamous portion, you have your mastoid portion, and then your mastoid tip, your external acoustic meatus, we're going to call that an EAM moving forward, so EAM. Styloid process, and then you have your TMJ and your zygomatic process of your temporal bone. Now, if there's 2 zygomatic processes, which there are, you need to identify which bone it's coming off of, so be sure to do that. All right, so it consists of a squamous portion, a tympanic portion, a styloid process, a zygomatic process. a pteromastoid portion, which contains the organs for hearing and equilibrium. So there's the three parts. So we're looking at squamous portion, mastoid portion. Here's your styloid process, and then here's your petrous portion. You can call it the petrous pyramid, pars petrosa, petromastoid portion. I usually call it the petrous pyramid. If you call it pars petrosa, that's fine too. This is where it sits within the floor of the cranium. So you can see you have your orbital plates here on your frontal bone. Here's your ethmoid bone, looking at the sphenoid here, and then you can see we have the petrous pyramids coming over here with your internal acoustic meatus. Your external acoustic meatus is over here, and then you have your jugular foramen magnum. Here's your occipital bone. So here's your petrous ridge here. Let you see where we're at, and here's your left temporal bone over this left, right. I like that it's backwards. All right. Situated on each side of the cranial base between the greater wings of the sphenoid and occipital bone, they form the large part of the middle cranial fossa and small part of the posterior cranial fossa. So this squamous portion is the thin upper portion of the temporal bone, forms the side walls of the cranium. It's a very delicate bone through the squamous portion. So the zygomatic process is the prominent arched process that projects anteriorly to articulate with the zygoma and complete the zygomatic arch. So like I said, if you're going to talk about the zygomatic process, you need to refer to which bone. So it would be zygomatic process of the temporal bone. So our articular tubercle, located on the inferior border of the zygomatic process, it forms the anterior boundary of the mandibular fossa. So the mandibular fossa receives the condyle from the mandible to form the TMJ. The tympanic portion is located below the squamous and is in front of the petromastoid portion. So it forms the anterior wall, inferior wall, and part of the posterior of the EAM. The styloid process is a slender, pointed bone projecting inferiorly anterior and slightly medially from inferior surface of the tympanic region. And you'll need to know that because that's where some muscles attach. That's important when you get to sectional anatomy. All right, the petromastoid portion combines petrous and mastoid portions. It forms the inferior portion, part of the temporal bone. It articulates with the parietal bone and is superior border with the occipital bone at its posterior border. Usually contains air cells, so you'll talk about the mastoid air cells, which vary in size, number, and how aerated they are. So a lot of times patients will get vertigo from having those air cells filled. So the mastoid process, it's a part projecting down from the mastoid portion. The petrous portion projects medially and anteriorly between the greater wings of the sphenoid and occipital bone, also called the petrous pyramid. It's the thickest and densest portion of the bone, and it's contains the organs for hearing and balance. So, bones of the middle ear, malleolus, incus, and stapes, and the temporal bone articulates with the parietal, occipital, sphenoid, zygoma, and mandible. So here is another picture, squamous portion. Here's your zygomatic process of the temporal bone. You have your articular tubercle with your mandibular fossa, your EAM. Here's your styloid process, your mastoid process with your mastoid portion here. So, review. The temporal bone houses organs for hearing and equilibrium. The squamous portion is thin and vulnerable to trauma. But yet the petrous ridge is the most dense portion, so it has the thinnest and the most dense. The zygomatic arch and the EAM and the temporomandibular fossa are the big things. So when we're looking at the inner ear, we have the internal ear, middle ear, external ear. So we have the internal acoustic meatus, 3 ossicles, and the membrane, tympanic membrane, and here is your EAM and your auricle pinea up top. Looking here at your semicircular canals, we have the vestibule, we have the superior semicircular canal, the lateral, and the posterior. And you have the pinea up top, and then you have your EAM. here's your mastoid process with the tip at the bottom and your styloid process. So your middle ear communicates with your nasopharynx, so eustachian tubes and the mastoid. So looking here, you can see where it's draining out there. Okay, here's a CT, a coronal CT of the inner ears. So you can see the mastoid air cells with the mastoid tip, and I think that's styloid process right there. And you can see your semicircular canals right there. It's pretty cool. Good shot of it. So here is another coronal. It's not magnified, but you can see you have your mastoid air cells with your auditory ossicles with your cochlea. You can see the cochlea right there. Pretty cool. And here's your EAM. Looking here, you can see how thick and dense this is, the Peters portion of your temporal bone. You have your mastoid air cells. You have your external auditory meatus is here, and here's your inner ear right there. Okay, so your sphenoid bone. All right, so the last one. It's irregular. It's a wedge-shaped bone that vaguely resembles a bat. So it looks like a bat. Located at the base of the cranium, anterior to the temporal bones and basilar portion of the occipital bone. Consists of a body, 2 lesser wings, 2 greater wings, and a pterygoid process. It contains 2 sphenoid sinuses and forms the posterior bony wall of the nasal cavity. It has a Sella Turcica, which is the deep depression on the superior surface of the body. It houses a pituitary gland, so it's important to know that. It's located in MSP of the cranial, 3/4 of an inch anterior and superior to the external acoustic meatus. So the tuberculum sellae is the anterior border of the Sella Turcica, where the dorsum sellae is the posterior border of the Sella Turcica, and the posterior clinoid processes is the top border of the dorsum sella. And there's also anterior clinoid processes, and I'll show you those. The clivus is a slanted area of bone, posterior and inferior to the dorsum sella, so it's continuous with the basilar area of the occipital bone. Remember how I showed you on the lateral and the occipital bone, the basilar portion, it goes in, it's continuous with the clivus, so you can use it interchangeably. I'm fine with that. So it supports the pons of the brain. There's the optic groove and extends across the anterior portion of the tuberculum sellae, and the groove ends on each side at the optic canal. So the optic canal. It's an opening into the apex of the orbit for transmission of the optic nerve and the ophthalmic artery. So it's actually the opening itself is called the optic foramen. So the lesser rings arise from the anterior superior portion of the body and lie horizontal on each side. They form the posterior medial portion of the orbital roofs, posterior portion of the anterior cranial fossa, and the upper margins of the superior orbital fissure and optic canals. Ooh-wee, huh? So the medial ends form the anterior clinoid processes. So the greater rings arise from the sides of the body and curve laterally, posteriorly, anteriorly, and superiorly. All directions, right? They form part of the middle cranial fossa and posterior walls of the orbit. There's 3 paired foramina situated on the greater wings. So there's the foramen rotundum, which is kind of up and under the lesser wings. There's the foramen ovale, which is shaped oval, and the spinosum, which is a little dot. It looks like a little dot of spit. That's how I remember it, spinosum. It's like a dot of spit. So the pterygoid process arises from the lateral portions of the inferior surface of the body of the medial portions of the inferior surface of the greater wing. You get all that? All right, it's better just to look at it. I'll explain it all when we see the bone. So the pterygoid articulates with the palatine bones anteriorly. The vomer is part of the nasal cavity. So the sphenoid articulates with each of the other 7 bones of the cranium and the zygoma. So here is the sphenoid bone in the floor. So we have the lesser wing right here. So this piece right here, so you can see how it looks like a bat. So here is the lesser wing, and off the lesser wing is the it's the most superior, and on the most superior part is the most posterior. So here's your anterior clinoid processes here. They come off of the lesser wing. Here is the greater wing on either side. So this is the greater wing. So on either side of the Sella Turcica is the greater wings. So the anterior clinoid processes point at the Sella Turcica. So within the greater wing, you have the foramen ovale here, and you have the foramen spinosum. So ovale, spinosum. Up under the lesser wing, you really can't see these when you're scanning a patient. This is your foramen rotundum. It's kind of tucked up under, up under. So they're kind of up under here. So they moved them down so that you can see them. So here's your Sella Turcica. This is your dorsum sella. This is your clivus. Remember how we talked about how the occipital bone comes up the basilar portion? So this is the basilar portion to the clivus. A lot of times you can't see the suture line, so it's hard to tell. So here's your spinosum, foramen spinosum, foramen ovale, shaped like an oval, foramen rotundum, it's round, rotundum, round. All right, so here's another picture. This one's kind of confusing. So you have your optic groove. Here's your lesser wing with your anterior clinoid processes coming off either side. Here's your greater wing, and you have your foramen ovale, spinosum, and then your rotundum. You can see it's obliqued a little bit, and you can see your rotundum right there. It's kind of tucked up under, like I said. Here it is at an angle, okay? So here's a wing, here's a wing. So you can see the foramen rotundum here. You can't see it on the other side. You can see the ovale, and it's kind of, since it's at an angle, you can't really see it. But the important thing to see here is your pterygoid hamulus and your lateral pterygoid plate. So those are the big things you can see when it's obliqued a little bit. Here is your Sella Turcica magnified. So we have your anterior clinoid processes. You have your posterior clinoid processes, and these kind of point backwards. So posterior pointing backwards. Dorsum sella, clivus, Sella Turcica. All right, so here's your frontal view, front AP view of your frontal bone. You have your sphenoid here on the left, so that's your red. Your ethmoid is blue, and purple is your temporal, green is your parietal. So frontal, parietal, temporal, occipital, sphenoid sinus here, and we have your body of the sphenoid sinus. You have your pterygoid process, and you have your hamulus coming off here. This is your vomer. It's a facial bone. We'll study that later. Here's your perpendicular plate of your ethmoid bone. Here is your cribriform plate with your crista galli coming sticking up right there, and here's your frontal sinus. So here is a CT of the floor. You have your anterior, middle, posterior ethmoid sinuses with your perpendicular plate. You have your sphenoid sinus. Here's your greater wing of your sphenoid with your foramen spinosum. It's off a little bit. There's your foramen spinosum. Here's your foramen ovale. This is your clivus here, and coming back around to your basilar portion of your occipital bone with your foramen magnum. So this is your mandibular condyle here. This is a CT sagittal reformatted, so you have your Sella Turcica with your posterior clinoid process with your clivus coming down here, and this is your sphenoid sinus, and you can see there's debris within the sphenoid sinus. All right, so that's it. It's a lot, and you're going to be required to know all of it. So memorize all of the foramens, know the sphenoid bone, know all your bones and who they articulate with. Okay? Good luck. I know you can do it.